This short video reviews some of my observations and some thoughts regarding some of the repeated patient case themes I'm seeing. This is regarding a reaffirmation of our prescription refill policy. This patient case highlights the correct way to handle a request for a pain medication initiation, increase, and/or adjustment. As shown in red in the lower right hand corner, you'll see that the response from the clinician was that the patient needs to schedule an appointment. So, whether or not the patient in this case comes to the office, or if the patient contacts you through your personal or through our text messaging services, through social media, or if you just see the patient in the grocery store, when in doubt, schedule an appointment before medications are initiated, adjusted, and/or increased. Again, telehealth is available. We do know that we have the exemption or exception for those critical medications such as insulin, hypertensive, or nitros. But when in doubt, schedule an appointment. In this patient case, it highlights the reminder that we see our COVID positive patients weekly at a minimum until they are released from your care. There was no active encounter on file for this patient. However, the patient was requesting medications for their sinus pressure and drainage. This patient case highlights, again, the reminder that our COVID patients are seen at least weekly, and it also cautions us in prescribing antibiotics for those self-diagnosing patients who have received, I guess, their MDs or their nurse practitioner licenses from either WebMD or Dr. Google. And it also speaks to patients who feel as though that they can bypass the layers of staffing and speak directly with the clinician. I want to go a little bit deeper regarding that because I have personally heard this message provided to staff and me by a number of patients for every single clinician we've had. Every doctor, every nurse practitioner has a patient or patients who feel as though that they can bypass the organization and go directly to that doctor. And we've had them even tell us, I'll just call Dr. X or I'll just call nurse practitioner X. So layer one is our front desk, our patient care representatives. They are going to request that the patient speak, as they did here, that an appointment be scheduled. The medical assistant will then take it after that has occurred, and if this patient or if a patient remains non-compliant, then the healthcare professional, the clinician, will have to intervene. A potential script or recommended script would be Mr. and Mrs. Patient to continue providing you a consistent standard of care. I'm asking that you follow the MCAP policies that my staff has asked of you. I will gladly continue to provide you the highest level of medical care, and doing that starts with scheduling you an appointment. This patient case is kind of a culmination of some of the other ones that we've seen here. First of all, we have patient who I guess attended Dr. Google or Dr. WebMD College of Medicine, and they know exactly what medication that they need. They've identified the fact that they're having a gout flare up. However, they also have self-released themselves to work, to go return back to work, and asking for you though to sign a letter stating that and to have you call them back. There is no telehealth visit in the chart. So we have a medication request, we have a diagnosis request, and we have a release to work request, all from a telephone call and no active encounter on file. This is a very problematic last slide whereby we have HIPAA non-compliance. Reminder, why is the wife in this case asking for a medication for the patient? Reminder, why is there no current appointment for this patient? Wife's not on the HIPAA form, patient's not calling. Why didn't the patient call requesting for his or her own medications? In the snippet, and it was just a quick Google, $1.44 million awarded to a Walgreens customer for a HIPAA violation of a similar format. Protect yourselves. Medical malpractice does not cover this type of HIPAA violation. Protect yourself. If a patient needs the medication, the patient needs to call for themselves unless they are an assigned guardian. They have power of attorney, and that is well documented, and or there's some other circumstance that would require you speaking to someone other than the patient. I came across a patient yesterday who was actually deaf. That would make sense. If we have patients who are unable to communicate in some way, then that makes sense. But again, not to have any of this documented, not to have an active encounter, just sets us up for exposure and a liability that we should not allow to occur.